Mr. Gomez. My name is Kelsey. I'm going to be your student nurse today. I'm from Grand Canyon University. Before I get started, can I get your name and date of birth? Perfect. So I'm just here to give you a little bit of information about COPD. COPD is a progressive disease that causes severe inflammation in your lungs and your airways. This causes you to not be able to breathe very well, especially when you try to breathe out. This disease does get worse over time and it makes you have a harder time breathing. It occurs when you get exposed to things like cigarette smoke, air pollution, bacteria, viruses, or even it could be like a genetic thing, so maybe someone in your family had it. And so when you're exposed to these things or have that genetic factor, it causes your body to react. And so your immune system has little cells that it sends to certain parts of your body and it tells it to create an inflammation. And so instead of doing it like a normal inflammation, like let's say you get a cut and you have a little bit of redness, what it does is it goes overboard and it causes a lot of constriction and, it blocks your airways and it makes it very difficult for you to breathe. And so especially when you're trying to breathe out with that inflammation and that blockage, it traps air inside. And so you may even see that your chest gets big and like a barrel chest. And that will definitely make you feel like you're not getting enough air in even though you're breathing. And so some tests that we do to see if this disease is happening with you, we would do like a physical exam, a medical history. We would want to see if anyone in your family had it. We would do some COPD questionnaires, assessments, and then we would do things like a spirometry. This spirometry tells us whether your airways are blocked due to that inflammation, and it tells us how bad they are and how we should proceed in terms of treatment. And then some other things that we might do are a chest x-ray, an ABG, and a 6-minute walk test. So with that 6-minute walk test, we have you walk and rest for about 6 minutes, and we put a little oxygen thing on your finger, and we try to see how much oxygen is in your blood and how well it's saturating. So major things that we would see that could put you at risk, especially ones that you can change, some modifiable risks, would be smoking. What this does in your body is it causes you to create more cells in your lungs, so what's known as hyperplasia, and it also causes you to create too much mucus. Another factor is that you have things called cilia. These are little hairs in your throat, and what they do is they move like this and they help move that mucus out. But what happens with smoking is that it destroys those cilia and you are not as effective at getting all that mucus out. So some other things that may make you more likely to develop COPD that are modifiable would be like infections, air pollution, and dust. Some things that you can't necessarily change that would increase your risk would be old age, genetics, as I said before, so like a family history of it, or asthma. So now for some treatment options. The first thing that we usually recommend is to limit your exposure to things like smoking, cigarette smoke, air pollution, things like that. Once we reduce that risk, we look into other treatments like medications, breathing exercises and techniques, maybe even surgeries. So some medications that you might see that your doctor puts you on is a bronchodilator. What this does is it helps open up those bronchioles, those things in your lungs that help you breathe and exchange that airflow. Those drugs will help you breathe easier. They'll open up that airway so that you can breathe. And then another drug that they may put you on is called a LABA. This helps reduce chances and occurrences of having really bad COPD attacks, or so you're having a really hard time breathing. It just helps reduce those chances of that happening. And then some surgeries that may help treat COPD would be lung volume reduction surgeries, bronchoscopic lung volume surgeries, and a bolectomy. You may want to talk to your doctor about those and see what they think in terms of those surgeries. We also may give you some oxygen to use at home. This is just to help make sure that you're not getting hypoxic, which is having low oxygen levels, which that can be pretty severe. So we may send you home with some oxygen. And then the thing that we really want to focus on is teaching you how to retrain your breathing and help build those muscles up and make you successful in your breathing. So one way we do this is pursed lip breathing. Basically, you're just going to use your lips to help control your breathing and help control that inflow and outflow of that oxygen and that air. Another one would be diaphragmatic breathing, which is using the muscles in your chest to take a deep breath and taking a really good deep breath. And then incentive spirometers, which help strengthen those breathing muscles and help clear the extra mucus that develops. And then lastly, I want to go over with you some things about your diet. Weight loss is something we typically see with COPD patients, and the bad thing about that is it can cause worsening COPD and causes a lot of COPD exacerbations. So we recommend that you eat lots of calories, lots of protein. Some ways you could do this would be to add sauces, keeping a bunch of your favorite snacks around, and eating foods that contain eggs, so maybe even desserts like chocolate cake, things like that. Also try preparing some meals ahead of time so that when you're having trouble breathing and you're really fatigued, you don't have to worry about making those things, because it can be very difficult, as you know, to do normal daily things. So that's one option. And then I know this is a lot of information, but don't feel bad if it doesn't make all the sense right now. If you have any questions, please let me know. Here's your call light. If you need anything, just hit that button and I'll be right there. Thank you.